So what is laser therapy? Well, laser therapy is the use of light to produce a specific stimulatory effect in the tissues. So we've gone from calling this laser therapy or cold laser or low-level laser just to photobiomodulation. The term photobiomodulation covers modulation of the tissues with light, and that means that LEDs and lasers are included in that definition. Laser therapy, though, has been studied since the 60s, and that the first finding there was that hair was growing back faster on mice that were being exposed to a red laser beam, and that really stimulated the whole idea of what's happening in those tissues to create more hair growth. And since then, it has gone way beyond just hair growth. Now we're talking about using laser for all kinds of stimulation in the tissues for healing and pain reduction. And there's more and more studies every year, almost 400 studies done just last year. And there's already studies that have come out this year that are really, really exciting. Laser is a great tool. And we're going to talk a little bit more technically about it at this point. There's a few terms you need to be able to understand so that you can travel with me as we go through utilizing laser. So the first word is wavelength. Wavelength is how we define the color of light that the laser is producing. Different colors mean different things in the tissues. The power is the brightness of the laser. The dose is how much light we're actually delivering to the tissues, how many photons are going into the patient's tissues that we're treating. And then frequency. Frequency is how fast the light turns on and off. If you're watching this video here on the right, you'll notice that it is steady. It is on continuously. So that's called continuous wave. But you can also pulse the light in different flashes. We'll talk just a bit about that. When we're talking about wavelength is our first one we're going to talk about here. It is one of the critical components to making sure you get good results with laser therapy. So this right here is your electromagnetic spectrum. You can see the visible spectrum of light between 380 and 780 nanometers. And that is what our human eyes can see on the visible side of things. Just to the right there, you see the infrared spectrum, and that is near, mid, and far infrared. And then you get into things like radio waves. If you go the other direction, you get into UV light, X-rays, gamma rays. Everything in the UV and down spectrum is generally considered to be ionizing radiation, whereas visible light and infrared light is not ionizing radiation. That means that your visible lasers and your infrared lasers are not going to be presenting any kind of damage or ionizing radiation for those patients.